Yeah, I guess it is what it is. All right, go ahead, Eugene.
Okay, it's recording.
All right, I'm ready.
Okay.
My name is Teresa Stites, and I have been the Tobacco Control Coordinator here at the Great Plains Tribal Chairman's Health Board since November of last year. When I was considering this position, and yes, I definitely had to consider it, I just thought about my dialysis patients who I used to serve in Rosebud, and how tobacco helped get most of those patients to my facility. Tobacco doubles our risk of diabetes, and most of those patients were still smoking, whether they had infections, missing limbs, teeth issues, and I had to sit back and realize that tobacco played a role in every one of my patients' lives. Also, during this presentation, I want to make sure that we understand that we're talking about commercial tobacco and never about traditional tobacco. I start this presentation off talking just a tiny bit about chanchasha, which is a Lakota word for our traditional tobacco. And we want to start it with chanchasha, and we want our people to end it with chanchasha. We want them to be in a full circle, and like we're supposed to be. And we want to go back to traditional and healthy ways for our people. This tobacco epidemic is affecting all of us, whether personally, whether it's our relatives or our friends, it could be our coworkers. Our people are still smoking, they're still chewing, and we are slowly killing ourselves. And we need to stop it. We're gonna start with some stats. Let's start with chanchasha first and move to our next slide. Chanchasha is a red willow bark, which is a spiritually important herb for the Lakota used in ceremony. Again, this word is just a Lakota word. I know that many other tribes have different words for their traditional tobacco. The uses of chanchasha are here on this slide. There's many: medicinal, ceremonial and in prayer, social. We use it for trade, and we also use it as a gift. We gift people with them, especially when we're saying thank you or we're asking for prayers. Sometimes it's also used to smudge and to purify ourselves, and it's said to cleanse the spirit and the body. This second slide here, it comes out of our Sacred Willow book that the Great Plains Tribal Chairman's Health Board had put together on chanchasha, on traditional tobacco, and it tells you traditional versus commercial, whether it's inhaled, not inhaled, what's sacred, not sacred, and you can go ahead and read the rest, but this is just a traditional versus commercial. Now, what we're going to start going into, we're going to start talking about stats. We're going to talk about national stats. We're going to talk about state stats, and we're going to talk about local ones, meaning the community. I wanted to break them all down. I also broke it down into our Great Plains region as well. So we will talk about those. They vary quite a bit, and that's also what we want to concentrate on, is that we need accurate data to combat this epidemic within our community. And all the communities that we work with here at the Great Plains, we work with 18 different tribal communities, and they are all different. So we want to keep that in mind. That's very diverse. Let's see, for our own tribes and communities, we need accurate data. We are considered a health disparity, which means there's inequality when it comes to access for healthcare. There's higher prevalence of chronic conditions, along with higher rates of mortality and poorer health outcomes for our communities compared to any other groups. The toll of commercial tobacco, and these are national stats. This is just basic, kind of what we all hear: 480,000 deaths annually, more than AIDS, alcohol, car accidents, illegal drugs, murders, and suicides combined. 16 million people suffer from smoking-caused illness in the U.S. Healthcare costs due to smoking, they say, is $170 billion. Due to secondhand, it's $6 million. And you can see that the tobacco industry can afford it. They're spending on marketing $9.6 billion a year, which is $26 million a day. They are definitely making money off of us slowly killing ourselves. If you look at the chart there, it's from the CDC, and it shows you that smoking overall in adults is down, but they remain high in certain populations. And the ones they point out here are Native communities, fall into all of them, basically. So this is something that's really important, not only nationally, but especially within our area, and knowing that these stats are affecting us in such a strong way. These are the national stats for American Indians and Alaska Natives. There was a national health survey taken in 2014, and nationally it shows us at having a 29.2% rate of current smokers. It's the highest prevalence compared to all other racial and ethnic groups in the U.S. And as you can read the rest, the national average is 16.8%, when in 1965 it was 42%. Like I said, we definitely have the highest prevalence here. But I want you to keep the data that we have in context, which is 29.2% is the national average. But this is taken from 566 federally recognized tribes. And we know that there's regional variations. We know that there's lower prevalence in the Southwest and there's higher in the Northern Plains and Alaska. American Indians constitute 2% of the U.S. population, and this next stat is actually pretty. American Indian and Alaska Native women who smoke while pregnant is at 26%, which is again the highest, and it's the only number that has gone up. Every other stat has gone down when it comes to tobacco, this tobacco control issues, and women who smoke while pregnant has gone up. According to the national stats, these are the top 5 leading causes of death: heart disease, cancer, accidents, diabetes, chronic liver disease, and cirrhosis. Now, those top 5 leading causes of death, they differ a little bit when it comes to national or state or our region, Great Plains region. But they're still there. They just are kind of turned around in their order. It's still the same 5 leading causes of death. Here, I just added a diagram that was included in the 50th Surgeon General report last year, and it shows that basically tobacco is affecting every part of our body in a negative way. If you look at that, it's everywhere. So it's definitely something that is affecting us in our everyday lives, and in the end, it's gonna probably affect us, affect our children, affect our households, and we won't live as long as we'd like if we're gonna be smoking tobacco. I have some statistics for the Great Plains area, and the Great Plains area is where we're at, and we're located in the 18 tribal communities that we work with, which are located in Nebraska, South Dakota, North Dakota, and Iowa. So these are stats for those 4 areas. American Indians constitute 6.5% of that population. The unemployment rate is 12% compared to 3% for whites. Below poverty level is at 41% compared to 9% for whites. American Indian women who smoke, and you see here our stats are higher, who smoke while pregnant are at 30% compared to 12% for whites. Uninsured is at 35% compared to 9% for whites. And here are the top leading causes of death within our Great Plains area: heart disease, cancer, other, accident, and diabetes. Again, the same top 5 causes of death, just a little jumbled up. Here's some state statistics, and like I said, these are the 4 states that we work with. Iowa, current smokers are 18%, no American Indian data. The Nebraska current smokers are at 17% compared to American Indians at 45%. North Dakota current smokers are 19% compared to American Indians at 22%. And South Dakota current smokers are at 19% compared to American Indians at 49%. And as you can see, there's a huge difference in the data and who has the highest prevalence of smoking. Although 49% seems a little more realistic and accurate to us, we know that within these tribal communities, we have quite a few that are higher, significantly higher. And that's what we want. We want these communities to get their own data, do their own tobacco surveys, and understand what they're up against. I just threw in a couple stats, or some information about giving it up and how much money we're spending. A 40-year-old who quits smoking and puts the savings into a 9% a year interest 401k would have $250,000 by the age of 70. Life insurance rates are double that of any non-smoker. Health insurance rates are higher for smokers, approximately $372 more a year. ACLU claims that 6,000 plus companies refuse to hire smokers, whether it's because of their health benefits, whether it's because of the upkeep of their location. There's a lot of things going on there, but that's what they claim, that 6,000 companies. Well, actually, companies are now asking you if you smoke or not. And that's part of their decision making and whether or not they're going to hire you. This is for your body, health-wise. What can happen if you quit smoking? And as you can see, I mean, it takes effect right away. Within 20 minutes, your blood pressure, your pulse rate, and the temperature of your hands and feet return to normal. Within 12 hours, your blood oxygen level has increased to normal. Within 48 hours, damaged nerve endings have started to regrow, and your sense of smell and taste are returning to normal. Within 72 hours, your entire body will test 100% nicotine-free. Breathing becomes easier, and lungs' functional abilities are starting to increase. Within 1 year, excess risk of coronary heart disease, heart attack, and stroke has dropped to less than half of that of a smoker. Within 5 years, your risk of stroke has declined to that of a non-smoker. And within 20 years, you are back to being a non-smoker. It's a pretty long timeline. So now we want to talk about what can we do. Okay, these are coming from the CDC, coming from the World Health Organization. These are strategies that they've already been working on. They consider mass media campaigns to encourage prevention and quit attempts as one of the #1 things that we need to be attempting to do. Of course, there's funding that we need and is necessary to do these mass media campaigns. And after they had a few focus groups on these campaigns and how people wanted them to be delivered to them, they didn't appreciate humorous campaigns. They wanted things that are graphic. They wanted to see the realness of what was happening by being a current smoker. And these here, I mean, just the top one on the right, that's just a perfect example of what people are saying that they'd like to see when it comes to tobacco prevention ads. Working on smoke-free policies is important, and implementing those policies and procedures. The next big thing is restrictions on youth access, which is getting our youth involved. I'll talk a little bit more about that in a sec. Price increases, raising taxes on them is another strategy that we've been given. And of course, quit lines, science-based counseling and medication, which South Dakota has the most comprehensive quit line in the nation. And you know, we're lucky to be part of that. Just talking about what can we do, I just wanted to say that in June 2015, Hawaii became the first state to raise the minimum age to 21. California is going next. California is going to raise that age next. As of February 2016, 125 localities have risen the minimum age in 9 states. Our youth are being targeted, and they're more susceptible to the effects. They're more susceptible to these media campaigns. And we think that's probably the way to go, is to start targeting the youth first. Another thing that we talked about was price increases, raising taxes. Turtle Mountain, which is one of the tribal communities we work with, they're located in North Dakota. They raised their tobacco tax by 5 cents. By 5 cents. And they had an extra $40,000 the first year. And they're using it they're using it towards tobacco control efforts. And from what I understand, they're in the process of raising that tax again. I also have a whole presentation on smoke-free laws and policies being passed nationally, statewide, and by the tribes. And I know that we are all heading in the right direction. Some communities are definitely slower. Some other communities are very progressive. And we're just working on them to get them to where they need to be, which is hopefully on the progressive side of things. We are sovereign nations, and we can make these policies and these law changes a reality within our communities. So it really is up to us to make this happen. So how do we do it? Now, the strategy that we've put together is really something that we took from the Chun-Li Coalition. The Chun-Li Coalition is a coalition that was formed over 6 years ago in Cheyenne River. I am Cheyenne River, so I'm very proud to say that. The Cheyenne River Sioux tribe is the 5th tribe in the nation to go smoke-free. And it is the only one in our region that is smoke-free. That's it was something that they worked on for many years, and it didn't happen overnight. And this is the strategy that they've come up with that we think that would be helpful to all of us. And we're actually working on an educational guide, resource guide with Chun-Li Coalition that we can share with our other communities so that we can get them on the right path as well. Their ideas are here. The first is to form and name a coalition. This is for funding opportunities and also to be inclusive for others to help and be a part of it. But number one, it's to have a name to your to what you're trying to accomplish. You're naming this group and you're saying that this is what we're trying to do. And forming that coalition is of utmost importance, because second, you're going to need funding. You're going to need funding to fight this epidemic. And when you form a coalition, then you have more opportunities. Second is to get accurate data for the community, to have a tobacco survey done. Let us help you with this. The communities need to see their own data to deal with this epidemic properly. And like I said, Chun-Li Coalition did their own tobacco surveys. From what I understand, they did a couple, and their community smoking rate was at 51%. I've had 2 other tribal communities in our region who took the tobacco survey, and they also were higher than 49 of what the state is saying. Both of those communities were at 61% for their current smokers. And last is the Santee Sioux tribe. Burfess recently did a study, and they did a survey out in the county where Santee Sioux tribe is located. And they show that 77% of that county are current smokers. So again, data is totally different by the community. And I think that's what we need to start building off, is knowing where we're at. Third is to start building momentum with your data once you have it, which is educating and sharing that information, getting it out into the community, just building it and getting people ready to move forward at the next step, which would be to start drafting new policies. And that's the last thing for them. That's what they think, that as far as moving forward and doing what Cheyenne River was able to do, which was to go smoke free. It's lastly is to start drafting new policies and to get them passed. Like I said, it took the Chun-Li Coalition 6 years before they got theirs passed. And starting small can help too. Like I said, let's do some policies on raising the minimum age on the reservation for smoking. I was at one of our tribal communities recently, And they were telling me how all the high schoolers smoke, because quite a bit of their juniors or seniors are over 18 years. So they're able to buy cigarettes for their classmates. This high school was actually letting these students take smoke breaks. So I'm going to assume that there's no policy in place. And if there is, then it's definitely not being enforced. And again, even once you draft these policies, you get them passed, which is, it takes a long time in itself. There's always going to be enforcement and education that's going to have to continue. And that's something that Chun-Li Coalition is dealing with. They still have their monthly meetings. They still, address these issues. They're still educating, and they're surely still enforcing. I just wanted to show a little bit of what Cheyenne River has done. Like I said, they're a great example. And again, I'm Cheyenne River and I love it. Here up on the left side, they did coloring contests within their community, which was big time. And the winner, was featured in the paper, and they used that drawing in quite a bit of their media campaigns. And, it was something just to get them moving. I wanted to mention as well that the youth were key. And Chun-Li Coalition stands behind that as well. The youth were key in passing that policy. The youth were the ones who went in there, and they lined up in the tribal council chambers the day that it was passed. And for 6 years, all the local people were going and talking to council, whether it was the nurses or the people involved in that way, the professionals. And council asked them to step aside that day, and they wanted to hear from the children. And, they did, and it was passed. So I think youth are a huge key to that. Another thing that we wanted to talk about was the second picture here on the left, on the bottom left. That these are just 4 of their media campaigns. That was before, the one on the bottom left was before they passed their policy, and they had done the tobacco survey, and they had added their own questions, which I think modifying surveys or making them fit your community is very important as well. And on the bottom of their survey, they added a couple questions, and what they asked was, do you believe that people should be protected from secondhand smoke in public places? And 75% of tribal members agreed with that, and many of them were smokers. And since then, I've met with many smokers in these different tribal communities who have said the same thing, that they believe that the public spaces should be smoke-free, and that they shouldn't be subjecting, if they're choosing to smoke, that they shouldn't be subjecting anybody else to that. So I think that's also a really big indicator of how people understand that this is an issue, and that, they are also concerned about other people's health, not only their own. This is an addiction, and it's something that they need to get help for. The top right one was just something that they were thanking the tribal council for once they went smoke-free. As you can see, that's part of their youth that were part of it. It was Teens Against Tobacco Use that they had in the high school there. And they've been smoke-free for a year as of this last May. So it's really a big accomplishment, and something that we should all strive for. The bottom picture on the bottom right is a picture of their billboard. They have that right when you drive into Cheyenne River. That's what you see, is that billboard. So it's working. It's happening in their community, and they're on top of it. And so, like I said, this is just a great model for other people to use if this is something that they're willing to do and willing to move forward on. Lastly, during my presentation that I did a couple weeks ago, there was a grant for tribes for the center, with the Center for Tobacco Control at the FDA. I spoke about it when I gave this live. This is obviously has passed now, because May 31st was the cutoff date, but maybe you should just keep this in mind so you can see that this is something that is happening. It was a grant for tribes for them to inspect and do compliance checks for their own tobacco retailers. And it would have been a great opportunity for all the tribes, and I really hope that many of them applied for this. I talked to the tribal policy analyst for the Center for Tobacco Control, and they've been in effect for 3 years, and they've only had 2 tribes nationally apply for this grant and utilize it. So again, this is just bringing more money into your community and giving you the control to do these inspections with these tobacco retailers, and giving the control to the community and to the tribe. I want to thank you for your time. I hope that you enjoyed it. I hope that it gave you a little bit more insight and information on what we're up against here within our Great Plains region, nationally. And like I said, this is affecting natives that they have the highest prevalence. So we really need to work this out and attack it. And we need to stop this. We need to stop killing ourselves. So again, if we can go back to our traditional tobacco, that would be great. Thank you for your time. Again, my name is Teresa Stites, and I'm the Tobacco Control Coordinator here at Great Plains.
Thank you, Teresa.
Okay. Are we good?